You, Celeste. Good morning, good afternoon, good evening, everyone, depending on wherever you are. Greetings from UNICEF and welcome to this webinar on the evaluation of UNICEF's work for children in urban settings. I'm Thomas George, Global Lead for Urban, your moderator for the day. And to start off this webinar today, let me invite Robert McCouch, the Director of Evaluation for UNICEF. He's joined this position very recently, and before that, he was working with WHO. Robert, over to you.
Thanks so much, Thomas, and thanks to everyone for joining. So I just want to welcome all of you to this webinar on the evaluation of UNICEF's work with children in urban settings. And a very special thanks to our presenters and panelists today. As Thomas just said, I just rejoined UNICEF about a month ago. And I can only be with you for a few minutes, but as all of you know who've just started a job, you have back-to-back meetings, meeting with all of your various stakeholders, so I can't stay for very long, but I did just want to welcome you all and say just a few brief words before handing it over to our presenters and panelists. As most of you no doubt know, thanks to climate change, of course, and other threats to rural livelihoods, migration and especially urbanization have been rising steadily in recent decades. As a result, child poverty and exclusion are increasingly urban phenomena. Over half of the world's children now live in cities, and many of them, as most of you probably know, are in slums and informal settlements. These trends are actually set to increase, if anything, in the coming years. So by 2050, it's expected that 2.5 billion people will be added to the world's urban populations, and 90% of this growth is projected to be in Africa and Asia combined. So again, since I joined recently, I only recently read the report, but as I read it, two global patterns struck me as being particularly poignant for the work, not just of UNICEF, but for all of us. The one is, it has to do with exclusionary growth and privatization in planning. In a way that excludes the urban poor, as well as new migrants from formerly planned city spaces. The other is widespread informality of urban settlements. So again, much of the growth in cities will occur in slums and informal settlements. And these are already home to 1 billion people. By 2030, that's just 8 years from now, it's expected that by then 1 in 4 people globally, that's about 2 billion people, will be slum dwellers. Both of these patterns are clearly interrelated from where I sit. So there seem to be two key takeaways as we enter into this discussion that I draw from this analysis, having recently looked at it. The first is that we all collectively have a very short window in which to work with countries and cities at subnational level to address equitable urbanization and inclusive planning, to reduce poverty and environmental risk, and adopt this urban lens. And the second is that of urgency. So without this urban lens, UNICEF's work and the work of all of us on cities and in cities are going to leave intact some of these underlying structural vulnerabilities that affect children. So with this in mind, and I apologize for setting such a doom and gloom scenario, but I think you probably have all seen the report or heard about its content otherwise. But I'd just like to once again thank today's presenters and panelists, as well as our partners, not just in UNICEF country offices who really capably assisted in this evaluation, but also our colleagues at WHO, UN Habitat, Save the Children, the Global Alliance, Cities for Children, and participants from across the globe who are joining us today. So have an enjoyable webinar, and I'm looking forward to following as much as I can. So back to you, Thomas, and thanks for everyone.
Thank you, Robert. Thank you for that brief on the status of urbanization and on the growth of slums and informalities. And we take note of the two key takeaways you mentioned: the short window to address these issues, and also the urgency to get our work going. Colleagues, this webinar is for 90 minutes. It will start with a presentation by the evaluation team, followed by a panel discussion by experts from different organizations, and we'll end it with a Q&A session. Please keep posting your questions and comments in the room for questions and comments and not in the chat box, please. And for the convenience of people from different time zones, we have the same webinar tomorrow at 6 a.m. In the morning, New York time. So you're welcome to come to that as well. Just to a note here that this evaluation was done last year, and we are well on our way to implement the recommendations of this evaluation. So I think this will be a good a forum where we can get more suggestions and strengthen our response. So without taking any more time, I would like to invite the evaluation team, Dennis Jobin and Sadishna Chatterjee, to make a presentation. Let me introduce both these presenters to you. Dennis Jobin is our senior evaluation specialist in UNICEF and was in charge of this evaluation. He has more than 22 years of experience in the fields of program evaluation, performance measurement, and performance audit. Before joining the Office of Evaluation, he was the chief of PME and field coordination with UNICEF Nigeria. He has also worked for Canadian federal organizations, including the Office of the Auditor General, and he has contributed and authored several international publications and reports focused on evaluation and related subjects. He was the vice president of IDEAS from 2006 to 2009, and he is currently the co-chair of Eval SDG. Sadishna Chatterjee, PhD, is a lead evaluator of this evaluation. She's an international consultant and is also the founder of Action for Children's Environments Trust based in Delhi, India. She has over 20 years of experience as an urbanist, urban planner, designer, researcher, evaluator, and educator. Sadishna has evaluated policies and programs for urban children across the world and served as an international research lead on multi-country projects in Bangladesh, Brazil, Belize, India, Japan, Lebanon, Nepal, Philippines, Spain, Sweden, Syria, Thailand, and a host of other countries. So over to you, Dennis and Sadishna. You have 30 minutes for your presentation.
Thank you, Thomas.
Thank you, Thomas. Okay, I'm going to do a screen share. Okay. So good morning, good evening, good afternoon, depending on where you are. Robert has really set the context, the urban context in which this evaluation was undertaken. Very briefly, the purpose, the objectives of this evaluation were really three. We wanted to assess the relevance of UNICEF's urban approaches, also understand what kind of results these approaches were returning, identify the good practices and lessons learned by UNICEF while working in urban settings. But in 2020, when the COVID-19 pandemic broke out, we had already actually finished the case studies for this data collection for case studies for the evaluation. But we couldn't ignore the fact that COVID was an urban pandemic. So we decided to course correct and include a rapid assessment of COVID-19 impact on these different urban approaches. The evaluation was primarily designed as a theory-based formative evaluation. In our initial mapping, we included all regions and countries, and we saw there are around 72 countries reported on working in urban in various ways. We looked at 5 detailed case studies in Belize, Brazil, Philippines, Spain, and Syria for the different approaches. And when we decided to include COVID-19 as a chapter, we again revisited Brazil and Spain and included a new country, India, for a different approach. But the interesting thing about this evaluation is that being theory-based, we decided to really engage with the understanding of urban, and the analysis was guided by something we call the drivers of change in the urban context, which is a theoretical framework that the evaluation team developed. It comprises three main drivers. Each of the drivers have several dimensions, which could actually provide a very interesting scaffold for conceptualizing equity-focused programming agenda for UNICEF going forward. I'm going to spend a little bit of time in explaining these drivers. Initially, when we constructed the framework, we did it for normal times, but when COVID again, we decided to engage with it, we brought a COVID lens to the drivers and did a reinterpretation. So the first driver is equity and inclusion, which really is at the core of the principles of the vision of change that any programming in cities for children should be based on. The first dimension is data. Now, this is central. Data is central to identifying the patterns of poverty and exclusion. It is also critical for strengthening any kind of measurement of intra and interurban disparities. But other than that, it is also important to conduct research on specific experiences and vulnerabilities of specific groups to inform any kind of evidence-based programming. And with COVID, we found that the scantness of urban data was further highlighted, which particularly with the amount of the less amount of data that exists for urban children in vulnerability. It also exposed the weaknesses in information collection systems and management systems, and overall a political sensitivity in releasing any kind of information for programming, which really thwarted a lot of efforts. One of UNICEF's core programming elements in urban is reducing inequalities in access to essential goods and services in cities. So the challenge in high and middle income countries for UNICEF is really to reduce inequities in access, while in low income countries and urban humanitarian contexts, it is about expanding access in situations of mass exclusion. When we talk about urban, and particularly given the fact that over 1 billion people live in slums, we cannot but ignore the housing crisis in cities, particularly the poor housing conditions that are a major driver of ill health and family stress, particularly in the context of insecure tenure, which is a basis for evictions and further deepening of vulnerability of the urban poor. So COVID-19 also spotlighted that the importance of having a secure home, which really became the frontline defense against the virus. Studies in India have shown that the risk of the virus spreading is really double than in any other urban areas as in slums. When we talk about poverty and employment, in urban areas, there is a distinction from rural areas. In urban areas, all basic needs have to be paid for, often at a very high cost. These are factors that are often not captured in poverty measurements. The cost of living in cities, as we saw in the case of the pandemic, forced millions of migrants out of the cities. And the images from India was so stark, and they really haunt us even now. Structural inequality is a primary determinant of urban violence, particularly in the context of Latin America. We see how these violence is disproportionately affecting adolescent boys in socially vulnerable urban neighborhoods, which has overlapping disparities of different kinds. However, sexual violence in private and public spaces disproportionately affect adolescent girls. And we know that tracking urban violence requires a coordinated approach for tackling economic, spatial, and social exclusion. The second driver, as Robert rightly pointed out, environment, urbanization, and planning, is something that development actors haven't really grappled with. Yet our cities are the way they are because of years of privatized planning, which had splintered urbanization with very rich pockets and then very, very underserved, impoverished peripheries, as well as areas where slums and informal settlements are the only ways to live for millions of people. And services and infrastructure are also privatized and splintered between these affluent parts of the cities and the poorer areas. And the COVID-19 evidence from India and Brazil show that this persistent inequality actually carried forward to even the provision and location of response infrastructure for the pandemic. Rapid urban growth with unplanned urbanization results in widespread informality. That is a given. And the fact that these informal settlements and slums became COVID-19 hotspots, primarily because of the inability of people to physically distance and also continuing to share basic services such as public toilets, water taps, etc. When we talk about urban safety, there is the UN system-wide guidelines on safer cities and human settlements that promote good governance, planning, and management beyond just a focus on crime and violence. And it also talks about how safer cities should be addressing issues of unplanned urban expansions, lack of safe public spaces, and a rise in road traffic accidents. But in COVID times, what we saw, the safety concerns of city today are much more linked to safe reopening of critical services, schools, public transport, public spaces, etc. And the tremendous rise in gender-based violence and also violence against children inside homes during the lockdown. Informality in cities, as we discussed, raises exposure to environmental risks, and which these are also compounded by climate change, pollution, and lack of adequate waste management in our cities. And a lot of the changes brought about by unplanned urbanization are important drivers of disease as well, and COVID-19 testifies to that fact. The last driver is about complex adaptive systems. Now, cities are characterized by very complex governance structures, and these include, in various ways, overlapping jurisdictions of national, regional, and municipal levels of governments. This complexity makes it more challenging on one hand to deliver assistance, but it also offers more opportunity for partnerships. Now, with a big push for decentralization in countries across the world, urban governments are increasingly accountable for the delivery of services to children and families. Now, in COVID times, governments are allowed to temporarily suspend their obligations by invoking special powers. But these kind of measures at city level can only be implemented successfully with the cooperation of all tiers of governments and other actors in this space. When we talk about public financing for children, now budgets for social services for children and implementation of local plans for children rely on both local and central revenues, but there is not enough tracking of how these budgets are or can be utilized in urban programming for children in urban settings. During COVID time, again, the fact that a lot of the public finances for children are under threat, budget tracking becomes even more important as a programming element. There is example from the India office in one of the states, Gujarat, that effectively did this for the state budget during the pandemic. When we talk about participation, we know that in the cities, even though there may be many more venues to influence government, but the urban poor face barriers to political influence and participation, and migrants and displaced populations face additional barriers. However, the importance of participation cannot be understated. Particularly during COVID, as we saw that community and adolescent involvement played a critical role in planning local level pandemic preparedness and response actions in collaboration with local bodies. And finally, the final dimension is about that cities have multiple actors functioning. Technical, human, financial capacities can vary widely between cities and prevent urban governments from reaching every child, especially the most vulnerable. However, the private sector increasingly provides services within cities, but often with issues of equity and quality. In COVID, again, we found due to travel restrictions and restrictions of movement of any kind, actually, local actors became critical to the pandemic response, which also was converted in some cases, in some countries, the necessity to build capacity of local actors to respond to the pandemic. I'm going to hand over to Dennis now to for the rest of the presentation. Thank you.
Thank you, Sadishna. This was very interesting and rich. So, colleague, participant, thank you. So, applying this analytical framework as explained and articulated by Sadishna, I'm going to present the key findings and the recommendation from this evaluation. So the first set of questions we had is what are the UNICEF approaches in intervening in urban area? So we found that there were three main approaches adopted by UNICEF: an integrated approach, a sectoral approach, and then CFCI approach. Within the integrated approach, there were some nuance. There were a certification-based approach and a partnership-based model. This partnership certification-based approach and partnership-based approach are well described by the SILO, the certification in Brazil, or the CFLGA in Philippines, as well as the partnership approach is the PCU in Brazil, for example, where they identify a few sectoral issues relevant to the big city or the mega city. Overall, there were approximately 72 country offices engaged into urban programming. Is less than half of the country office, and only few work into an integrated approach. We found 5. The integrated approach is the one that has the strongest potential, though, to demonstrate results through and to address the inequity and the deprivation of children. So that was an interesting finding. Most countries were using a sectoral approach, but they have limited sectoral strategies and guidance to further guide them into that. We found that only WASH has developed a comprehensive urban strategy, and health has some guidance for urbanization, but that was very, very limited. We found that mostly of any of the approach, the urban programming were run as a side project, so they were not fully integrated into the country program. And out of that, we found that 45 countries were working on the CFCI model in 2019, which 15 were program country in the developing country or the South. We also found that CFCI framework is not really attuned to reduce disparities and urban setting, nor that is a specific target and indicator that to address and to focus on the deprivation and the disparities. We also found that the recognition process of CFCI is weak. It's given in anticipation of a result to be achieved, and there's little evaluation or follow-up undertaken, and this poses a serious reputation risk for UNICEF. Next slide, please. So on the equity and the driver equity and inclusion, essentially we found that the approaches that address equity and inclusion better, more robustly, are using data and analyzing data for urban purpose, whether intra-urban data and yes, sectoral data. We found, however, that when we conduct a situation analysis in the country, it does not, and even if we pick up urban problem in the situation analysis, the CITAM, it does not necessarily translate into urban programming and much. So we still, there's some gap here and maybe additional guidance. There's also gap that the data on slum and informal settlement and access to quality local data in general and capacity for urban data analysis. Main lesson from the COVID-19, the chapter, we found that UNICEF and using data, UNICEF Brazil did a lot of investment and during the pandemic, and we were able to use existing geospatial epidemiological data at the city and municipality level to identify hotspots and to help to focus and target the response for COVID-19. So it was really a strength of the urban approach to use this data and to inform where the response should be focused. So that was a key main lesson. Next slide, please. On the driver of change, environment, urbanization, and planning, we found that UNICEF does not confront few major trends in urban context. First, exclusionary growth and privatization in planning that exclude the urban poor and the new migrant from formally planned city space. For instance, with over 1 billion people living in slum, and that number is likely to double, addressing the needs of vulnerable children in urban settings is very important, especially for slum and informal settlement. And we believe that it should really inform the UNICEF agenda in the future and maybe becoming what will be your brand in addressing the urban slum. The COVID-19 actually highlights some interesting lessons, essentially that there are hidden vulnerabilities that are pertinent to urban area. Actually, the COVID-19 maybe is a urban crisis within a global crisis. Yeah. The other trend is widespread informality and in developing cities. So we mentioned the slum and the informal settlement and the population, the growing population in slum and informal settlement. So this is something that needs to be addressing, and how UNICEF will focus, prioritize slum and informal settlement in its urban agenda. Another threat is the rising threat of pollution and environmental degradation, disaster, and climate change that affect the urban environment and urban area. UNICEF work on cities even take the underlying social vulnerabilities and affecting urban children without addressing equitable urbanization and inclusive planning. We found that in India, the COVID-19 demand program response, especially to focus on some, I think I mentioned that. And in Spain, the pandemic recovery planning through sustainable and child-friendly urban planning was a highlight of this main lesson for the urban. Next, yeah, you turn to the next slide. So for the complex adaptive system, the evaluation note that there are gap relating to how UNICEF engage with the private sector, and how UNICEF engage in complex system involve managing urbanization and planning. And another area that could be certain is the public finance for children, the PF4C. So this is three gaps that are related to the summary of the finding. We also acknowledge, however, that some country office and partner national committee are keen to address this gap in the future and to take this challenge on board following this evaluation. The main lesson from the COVID-19 is investment in preparedness pays off, especially at the city or urban level. Having shock responsive social projection system, enabling more agile response, especially through cash transfer. Having city-state that face emergency in the recent past were good in preparing them better for the new one. So past experience and past investment in preparedness were very helpful. Country with existing urban program were able to rapidly respond at scale to protect population and to ensure continuity of service by different strategy. Examples, leveraging data, engaging in useful and relevant partnership, city level platform, and government and civil society relationship. Yes, next slide, please. So essentially the recommendation, this has been, report has been shared a while ago. I'm just going to mention them rapidly, not going to go over them, but first to note that all recommendations were agreed and accepted by the management of UNICEF. So that was a success in that sense. On the key one, for the first one is really to update the urban strategy note and having an organizational procedure with clear direction for country office and how UNICEF will enhance its support for children in urban setting. So that was a key agreement and step. Okay, so to really step up the game of urban programming within UNICEF. So this was translated in additional target in the new strategic plan, result area across the goal, and it's a work in progress. Well done, but more needs to be done, we believe. But it's a good work in progress. Next slide, please. Just going rapidly. So for the next recommendation, based on the analysis and the different model and success and performance, we divided into two categories of setting, if we can. So the low and middle income country, we believe that based on the finding and when presence of informal settlement and slum, UNICEF should prioritize addressing the need of these children through an integrated approach, and so really to develop a whole organization approach, advocacy, partnership, fundraising, but really prioritize on slum, and this should be translated into their CPD and work plan and engagement with government. So we really want to see some more work going in that area. Of course, among the strategy and the way to go is to develop, identify partnership, and I would say not only relevant partnership, but to address this complex problem of slum and informal settlement, maybe to engage into extraordinary partnership at different level of the government, central, provincial, state, municipal. So it requires a lot of partnership in this area. In the in the high-income countries is because there were some merit and popularity, success with the CFCI, I would say, with potential with the model, and I think to refocus the CFCI to deepen the engagement with child right and advocacy and child participation, really to clarify the accountability and within UNICEF and in high-income country, to focus onto that, given the FCI as is not designed to attune the disparity and multiple vulnerability, and to address the reputation risk that this is posing for UNICEF to have a child-friendly city in the country or in a city where there's some child violation, grave child violation. So this has to be tackled, and we encourage the new model to seek partnership, a bit like the Philippine model, where the government owns the certification process. Next slide. Essentially, in the there were a lot of gap in the humanitarian. We had difficulty to find some good case in the humanitarian setting. So we went to Syria. It was essentially WASH, but it's really to see how the new program approach can address the humanitarian development nexus in city and town, and go at the local level and explore how we can address the pocket of these vulnerabilities that are there. It will require some change into the preparedness, or either to further operationalize and how to apply the CCCs in urban setting and slum and informal settlement particularly. To do that, while we did not go into detail into the capacity of UNICEF, we did find that there were some gaps, some issue in terms of staffing and architecture of staff at all levels of the organization, and we need to rethink how does it mean. Is it to refocus the accountabilities, or to hire some urban specialists at the to support the country office, and so to empower the regional office and country office to implement, especially where there's big slum population and informal settlement in the country. So essentially, these are the recommendations. You can appreciate the management response is also online. They were all agreed, and the work is ongoing in terms of addressing these gaps currently by UNICEF. Thank you all, and over to you, Chair.
Thank you, Dennis, and Sadishna for the detailed presentation and for keeping to time. I would also take this opportunity to thank you all for adding the COVID lens midway into the evaluation. That's really produced some evidence which was very useful in taking our urban program forward. As everybody is aware, COVID exposed the hidden vulnerabilities of poor urban dense settlements, and that's also taken a place in the urban discourse now. Dennis and Sadishna, please also see that there's a question on gender in the question answer box, so please address that. Now we move into the panel discussion. We have three experts today joining us: Natalie Robel from WHO, Soumen Bakchi from our UNICEF India office, and Sarah Sabri from Save the Children. So we start with Natalie. Let me introduce Natalie Robel to you. She's the lead for WHO's work on urban health in the Department of Social Determinants of Health. Prior to this, she was leading WHO's work on air pollution and housing in the Department of Environment, Climate Change and Health. One of our main areas of work was the development of WHO housing and health guidelines and WHO's effort to address slum upgrading through housing policies and other social policies and interventions. Before joining WHO headquarters, she was a technical officer at the WHO Regional Office for Europe. She has a PhD from the University in Bonn. Natalie, over to you. You have 10 minutes for your presentation.
Thank you very much, Thomas, and good morning, good afternoon, and good evening to everybody. It's a real pleasure to be here. I mean, I think it's pretty obvious in my current role in leading WHO's and coordinating WHO's work on urban health. but also particularly having been working on some of the key sectors and key areas of work that are, at the center of UNICEF's work in the context of urban environments and children. So maybe next slide, please. So maybe just to start, my reflections, you will see, really draw on the fact that there are a lot of similarities between UNICEF's urban programming for children and actually our own WHO's approach to urban health. Similarities in some of the approaches that are taken to the work, but also similarities in some of the challenges that, that are currently or have been faced. So maybe just starting about some of the similarities. I think what has been very clear from the analysis and the review that was just presented is that we are speaking here about several different approaches, the sectorial versus the partnership versus the integrated, that are actually somehow seen to be siloed as regards to urban guidance. And this is something that we are facing actually in WHO as well, where we have specific work looking at sectoral interventions to address urban populations and urban health more broadly. At the same time, we have a large number of partnership activities leading networks of cities, being it to address air pollution and climate change, or age-friendly cities, or healthy cities more broadly. And then also we have dedicated work as regards to urban governance. But similarly, I would say to the work that has been reviewed here and that UNICEF is undertaking at this date, we still see it somehow as siloed, separate approaches. An additional point, also speaking from the experience of WHO, but also that I see reflected in the work of UNICEF, is that we are still confronted very often with the dichotomy of programmatic approaches versus project approaches. And certainly when we look at the urban health agenda more broadly, there is an added value of taking a more programmatic approach rather than a project-oriented approach, because we do see the added value of developing comprehensive frameworks to support local governments in addressing specific population groups, but urban health more broadly. And finally, also one other maybe commonality is the emphasis on key sectors as maybe key drivers for the work on urban programming for children in UNICEF, but similarly to WHO. And WASH has been highlighted also by Denis and Sadishna before, but certainly this is something that we see also in WHO. So there seems to be an emphasis on a limited amount of sectors, while actually there is a larger amount of potential sectorial work to be maybe emphasized and supported. Now, quickly moving to the similarities that also we are facing, specifically highlighted as challenges. And this was not necessarily highlighted in the presentation, but it has come out from the report, is the human resources issue that organizations and UNICEF is facing it similarly to WHO and others as regards to human resources to address this topic at the 3 levels of the organization. So we are still seeing a really unbalanced, I would say, human resources human resources, the force of human resources attributed to this area of work, and in particular, I would say, at the country office level. And the final point, very general point, is that something that is very striking, that there is a lot of similarities, I would say, between the work of UNICEF and WHO, is that the engagement strategies with local governments still requires some fine-tuning. And I'm giving you the example of WHO, where actually our counterparts are obviously member states at the national level, and in particular, ministries of health, but where we are increasingly working with local governments without at this moment having maybe still very concrete and operationally planned ways of engagement. And I do see similar, I would say, challenges in UNICEF. So maybe moving to the next slide. If looking in particular whether the approaches that have been taken by UNICEF are, in alignment with our thoughts, whether some others should be identified. I would rather say than not to use additional approaches, but having maybe some focus in integrating those three approaches that have been identified. So the idea is really to see how those different approaches, the integrated approach, the sectoral approach, but also the child-friendly cities initiatives approach, so the networking approach, the communication approach, should be actually put together in a more programmatic, as I was saying before, vision, and being seen as one and the same integral approach to the topic rather than siloed with those different entry points. Also, when looking at the sectoral approaches, I would say that there is a need of looking at how one sector could actually be combined with the work on other sectors rather than siloed. So if we look, for example, of WASH, or we look at health, or we look at education, they shouldn't be seen necessarily as indivisible and separate entry points to the work, but being really seen with all their potential for co-benefits. And certainly health, this is something that I would like to stress here. I would see it not as a standalone entry point or sectoral approach, but certainly as a cross-cutting part of all the sectoral work that has been promoted. And certainly I would also say that for these sectoral approaches, there is an increased interest in increasing collaboration with other agencies. And I think that there are very good examples to build on. The WASH example is a key one, but also the work that is now being done on public spaces, where, for example, WHO, UN Habitat, and UNICEF are closely working. So particularly when looking at sectoral approaches, there is an opportunity of strengthening the collaborations with other agencies. The additional point as regards to the approaches is when looking at the networking, the child-friendly initiatives, there is a potential to really try and link it to other existing networking mechanisms led by other organizations. Very often we see that cities are overwhelmed when they are part of one and more organizations, and very often with the limited human resources that they have, there is an interest of trying to see how to synergize, how to really bring all those different initiatives together and also to maximize the efforts. And finally, you heard Thomas introducing me as somebody who has been working for quite a long time on housing. I think that there is an added value of scaling up resources and investments through key sectors, but in particular through housing. So in the particular work here of UN Habitat, I would see actually housing not only as part of the drivers, but as a key sector to actually be focusing more of the work. Next slide. So when looking on how relevant the drivers are in shaping future urban programming, so the drivers that have been identified and that Sadishna presented, I do think that the drivers that have been identified are of essential importance, and they actually do very well capture the influences of the urban context and the situation of children in particular in the urban context. Maybe just to focus on some of the aspects that have been identified and maybe data in particular. Sadishna, you were speaking quite a lot of the data situation, the data need. And I think that here there is really the necessity for agencies like UNICEF, WHO, and others to really make an effort to increase community engagement, not only for policy implementation and prioritization, but also for data gathering. We know that in particular for informal settlements, we do not have sufficient health data, and there are quite a lot of activities, there are a lot of initiatives ongoing where slum dwellers initiatives do actually collect data. So we need to increase our mechanisms in our respective agencies to be able to capture those data, to work with the communities in order to be really to influencing policy changes. And as regards to the drivers, just building back on what I was saying before, maybe pausing on housing and also putting it in the specific context of COVID, I think that there is an opportunity of looking at housing also as a part of the health systems. We have been seeing now in COVID that housing has actually become a response mechanism to the COVID crisis, where policies have been put in place to stay at home, where some of the health services have been delivered in the houses themselves. So there is a key opportunity of seeing housing here not only as a determinant, but also as a key determinant of within the health system. Focusing on urbanization and in particular planning, I would say that this is a major determinant, and some of the evaluations outcomes were showing that this is maybe one of the new areas for UNICEF, but certainly this is one of the key important areas to look at, but also not necessarily as a challenge, but also as a major opportunity. We have seen that urban planning is a key vehicle actually for promoting and protecting health. So this is really one of the drivers that should be giving major attention. And finally, I would say under the complex adaptive systems, I think one of the key aspects on urban governance would really to focus on their interactions between local and national. And we are seeing here in WHO that when wanting to support local governments, this needs to go along with strengthening national governments to understand the needs and the support that need to be provided to the local governments. And I see Thomas appearing on the screen, so I guess I need to wrap up. And just to finalize, then maybe one key driver that I feel is missing is health and well-being. That needs to be an integral part of all the drivers, because this is an essential, cross-cutting mechanism throughout. Last slide. This is just to maybe wrap up what UNICEF, you see, I'm saying what WHO, but it's actually what UNICEF can do to achieve results more. It's because they're the same, I would say, for WHO, is really to aim to an overall strategic planning on children in urban setting. So really a broader framework, to have technical and sectoral guidances to be paired with other agencies, and then a harmonized approach between the different levels of the organizations. And finally, really trying to have a more programmatic approach versus an initiative-based approach. And I'll stop here. Thank you very much, Thomas. Over.
Thank you, Natalie. All very good points. Let me start by saying that we are working on an integrated framework for our work across different territorial contexts. So that's well taken. On housing as a sector, fully agree with you. At the moment, we are developing a discussion paper with Habitat for Humanity and UN Habitat on housing as a child right. And how it has to be implemented. I like your interest and your support for that, and I'm sure we'll be reaching out to you soon on that. We also take note of the fact that health and well-being should be a key determinant of any urban programs. Here I would like to take the support of WHO to, strengthen the UN coordination for urban programming. We have a system-wide strategy for sustainable urban development, but I think we need to have a technical task force there to strengthen that, and also how we engage with the UN cities, because ultimately the programming will have to be taken up at the country level. So thank you, Natalie. Thanks a lot. You will be hearing more from us in the near future. Let me now invite Saumen Bakshi from the India Country Office of UNICEF. He's the social policy specialist and the urban focal point there. And he comes with more than 25 years of experience with working with governments at various levels in urban project design and planning, project development, management and implementation, capacity building and institutional strengthening. His work always had an emphasis on urban infrastructure, project development and financing. He's an economist by background with a PhD in urban infrastructure financing and municipal financial management. Before joining UNICEF, which was like very recent, Saumen worked with IPE Global and also led the mission management unit of Smart Cities, which is a government of India's flagship program for 100 cities in India. So Saumen, over to you. You also have 10 minutes for your presentation.
Thank you, Thomas. And good morning, good afternoon, and good evening, wherever you are across the globe. And without wasting time, if I can request to go to the next slide, please. See, when we look at the urban issues, India faces more challenges because of its overall structure. And as we know that India is a federal country and there is a state government between the national and the local governments. And as per the Constitution of India, the urban governance is a state subject.